Tonight, we're getting perspective from Spectrum Health's Chief Operating Officer on hospitalizations related to COVID-19.
The health system is preparing to administer its 300,000th vaccine dose, all while inpatients are now above 230 across the hospitals.
News 8's Lindsay McComal spoke with Brian Brazier earlier today about his concerns.
In the fall, we topped out just over 300 patients across our West Michigan hospitals. And so we're about 2/3 of the way there. The overall trajectory is concerning. We have seen day over day increases nearly every day for the last three to 4 weeks.
And we are seeing, at least in the data statewide, that it's younger people who are getting sick and younger people who are ending up in the hospital. Is that the same trend?
Yeah, absolutely. And so what that means is our average age of an inpatient through the fall surge, the October, November, and into December, those months, was 65 years old. Our average age now is 57 and a half. And so we are seeing a pretty significant skewing younger, but thankfully that's also resulting in less ICU usage and less vent usage. Now, that's with the caveat that what we found in the previous surges was that oftentimes the severity of illness actually worsened as the pandemic and as the surge progressed. And so we're watching that very carefully. But what we've seen so far is it gives us some hope. And it also tells us that the vaccines are working. Very few of our patients who have been admitted have been fully vaccinated. Very few of our emergency room patients who are coming in with COVID-like symptoms have been fully vaccinated.
And when you look nationwide, Michigan is a state that still does have a lot of restrictions in place, but we are seeing the highest amount of cases right now. So how do you respond to people who criticize that and say, well, let's not, why don't we just act like Texas is, open everything up, and they seem to be doing okay right now?
It is a debate that I think will persist to the end of time. And I think that each state has its own unique characteristics. Obviously, there are a lot of people who are studying and looking for those causes and effects. But it's a tough one, and it certainly generates a lot of debate. That is for sure. I think ultimately, though, where we are now, we're very concerned because that positivity rate. We watch our internal positivity rate. We test about 2,500 to 3,000 patients a day, and so we can look back at yesterday. There's no delay in terms of getting the numbers back or having them run and aggregated. And what we see is that we're at about 19% positivity yesterday on 2,600 tests. And so it speaks to where we are on the west side of the state specifically. And it speaks to really the importance of us following those best practices so that we can interrupt the spread of this virus.
Do you have any other messages for West Michigan right now?
Please, when it's your time and when the vaccine is available for you, get the first one that's available. This is what's going to help to lead us through this pandemic. We have this race against the variants specifically, and the vaccine is so key.
A new national study is suggesting that the overall death rate among hospitalized COVID-19 patients decreased over time. The study looked at more than 500,000 patients. The researchers saw that while the overall death rates increased from 10% in March of last year to a peak of 19% in April, they then dropped significantly to 9% in November of 2020. The study authors say one of the reasons behind the decline may include increased clinical experience in caring for those patients.